We've been working on for quite a while for you folks. When you think of pregnancy, often the first thing that comes to mind is the happiness of new life. Unfortunately, it's not always happy. Tonight, Brittany Tarwater and investigative producer Emily Akiyama take a deeper look into Tennessee's maternal health and just one of the many factors that make our moms vulnerable.
That's a hard pill to swallow.
That's Dr. Lovie Stallworth's reaction to hearing Tennessee had the highest 5-year rate of maternal deaths. That's 166 moms from 2018 to 2022. Even more shocking, the state's Maternal Mortality Review Committee found 76% of pregnancy-related deaths in 2022 were preventable.
It's gut-wrenching, and I came across that statistic. My oldest daughter was living here and she was pregnant, and her going, and she was like, "Mom, did you know about these numbers?" And she's like, "This is why I'm so, I'm scared and I'm an hour away from the doctor."
Stallworth is a physician at Servolution's rural clinic in Claiborne County. The clinic is tucked away in Speedwell. A March of Dimes report puts the county in the low access category for maternal care.
We don't have an obstetrician in this county or even in the neighboring counties. So now your closest is you're either going to Morristown or you're going to Knoxville or you're going to Kentucky.
In East Tennessee, Claiborne is just one of 7 counties listed as low access for our maternity care deserts.
The number of smaller institutions that can recruit and retain obstetricians and gynecologists has gone down. Many of those hospitals have either terminated those services, or patients are having to travel even greater distances to get to smaller facilities.
In Claiborne, Campbell, and Fentress, that's almost 40 miles. Scott County, nearly 57 miles. On the other end of the spectrum, Knox County is about 8 miles. Anderson, Blount, and Sevier, around 6.
We're having to get really creative, especially on the high-risk side, to make sure that people can reliably get the help that they need during pregnancy.
One solution the March of Dimes has proposed is telehealth coverage, something UT Medical Center is already working on.
So that they can obtain access for things like diabetes management that doesn't necessarily require us to be in the same room, and can maintain appropriate ultrasound surveillance in a pregnancy, again, with us reading those scans remotely.
But that isn't always easy.
I've got some patients that I do telehealth for. They're not able to leave the home, have just had surgery. I've had others that don't have electricity, don't have internet access.
But the physical distance is just one factor in why moms in Tennessee are dying after giving birth. The state's Maternal Mortality in Tennessee annual report lists some of the leading causes of pregnancy-related deaths: mental health, cardiovascular conditions, and infection. This topic affects so many of you in our community, and we want to hear from you. Right now on the WVLT News app, you can connect with us as we promise to continue bringing attention to this serious topic and explore some solutions in our community, bringing forth to make sure moms and babies are healthy.